One of the most climate vulnerable countries in the world, Pakistan, will push rich polluting countries at COP29 to honour earlier pledges on climate finance. Millions are still struggling for full recovery after floods 2 years ago left a third of the country underwater. Health experts say the spread of waterborne diseases has been challenging and could trigger a public health crisis. Hira Mustafa travelled to Southern Sindh, one of the hardest hit regions.
This is the second time in a month that 3-year-old Fiza has contracted malaria. Her mother, Fatima, says the local hospital sent them home with some medicine. But she fears that for Fiza, it's too little, too late.
2 फौत हो गए मलेरिया में झटके हो रहे थे उन लोगों को इसको भी झटके की असर है तेज बुखार होती है ना फिर उसको झटका होती है
Fatima Bibi and her family of 5 children live in this one-room mud house. There is no toilet, no running water, and the nearest source of clean drinking water is a 30-minute walk away.
हमारे गांव में गंदगी भी बहुत है किचरे बहुत हैं इसी वजह से मच्छर हैं क्या करें बस गरीब हैं रहते हैं क्या करें कहाँ जाएंगे पहुंच इतना नहीं है जो शहर में बैठेंगे या बच्चों को देखभाल करेंगे
Not just Fiza, countless children in the Sajawal district in Sindh are sick. We are told that every family in this village has at least one child who is suffering from skin disease, diarrhea, cholera, dysentery or malaria. Much of it a consequence of the 2022 floods. According to the World Health Organization, Pakistan saw a huge spike in malaria cases after the devastation from 400,000 in 2021 to over 1.6 million in 2022. The biggest surge was reported in the worst-hit provinces of Sindh and Balochistan. 2 years on, in many parts of Sindh, floodwaters have not receded, nor were water supply and drainage systems repaired. Severe monsoon rains in August this year once again inundated these communities, flooding ponds, wells, rivers and bunds. It's forced this community to use the stagnant, contaminated water for cooking, bathing and drinking, putting them at increased risk of recurring health problems.
वो वाटर जो वज़ीर-ए-आज़म पिए, जो सदर पिए, जो चीफ मिनिस्टर इस्तेमाल करे, जो हमारे ऊपर वाले सरमाएदार वो आम बंदे को भी पीने का वो साफ़ पानी मुयस्सर हो। हाइजीनिक से हम ओवरकम कर सकते हैं 15% डिजीज़ पे। इस पे एक फ़र्द से लेकर गवर्नमेंट सारी अगर जो है ना इस पे काम करे तो बेहतर नताइज हो सकते हैं।
Compounding the crisis in waterborne diseases is a lack of toilets and basic sanitation, forcing villagers to defecate in the open. This not only threatens the safety of girls and women, but also exposes them to higher risk of infection. UNICEF says 53,000 Pakistani children die annually from diarrhea due to poor water supply and sanitation.
डिफरेंट एनजीओज़ हर एक कैपेसिटी के अंदर जो भी उनको फंडेड प्रोजेक्ट मिलता है तो उसी के मद्देनज़र रखते हुए वो कोशिश करते हैं कि एट दी अर्लीस्ट जितना हो सके हम लोगों को रिलीफ दें लेकिन यह है कि बहुत ज़्यादा मैसिव लेवल पे जब फ्लड आती है और ऐसा तरीका सैलाब आता है तो हम तो बस ये है कि कुछ टारगेटेड कम्युनिटीज़ को टारगेट कर सकते हैं हालांकि नीड बहुत ज़्यादा होती है
This packed hospital in Southern Sindh reveals the extent of the health epidemic. Overwhelmed by the caseload and with a shortage of beds, only the most severe cases are admitted.
अभी हमारे पास कम से कम 300 से 400 मरीज एडमिट है यहाँ पर जिसमें मोस्टली हमारे पास 150 से 200 हमारे पास मलेरिया की है
Dr. Arshad Ali is on the front lines of this battle. He says a shortage of malaria medicine is impacting urgent care and worries that the hospital's inability to treat every case is endangering the future of an entire generation.
पेरामाकोइन तो कभी कभार गवर्नमेंट की तरफ मोस्ट गवर्नमेंट की तरफ से आती है क्योंकि प्राइवेट स्टोरों से नहीं मिलती, उस ड्रग की कभी कभार शॉर्टेज हो जाती है। हाइजीन और सैनिटरी कंडीशन अच्छी नहीं होगी, मलेरिया फ्लड के बाद इतनी अच्छी नहीं है, पहले भी इतनी अच्छी नहीं थी, अभी और भी हमारे पास पॉपुलेशन भी पॉवर्टी वाली है।
Health officials warn of a looming public health emergency if the situation doesn't improve.
क्या कहते हैं, नई जनरेशन जो है वो वीक होती जाएगी, उस समय वो जो है न्यूट्रिशन होगी नहीं।
The Sindh provincial government is trying to address the problem by working with local NGOs and UNICEF to install hand pumps and toilets, but it admits more needs to be done and has accused the international community of ignoring Pakistan's plight.
The international world should think when they promise to then help those countries. Like Pakistan, we are third world country, we have to admit it. We don't have that capacity.
But observers say the government's patchwork approach to climate mitigation means that the most vulnerable often get overlooked.
I think political will priorities are not that high from climate change perspective. Most of the people who have been suffering are poor. They don't have that kind of political strength which actually can reach to that level where people get resources from the government.
Here at Ground Zero, away from the blame game, affected communities say the cost of waiting is far too high.
Waterborne diseases continue to ravage women and children in flood-stricken villages. People are demanding urgent action to combat this crisis, calling it a litmus test for the government's commitment to the community.
Hira Mustafa, CNA in Southern Sindh province.